Britain is getting sicker, hospitals are overwhelmed and GPs can't keep up with demand. Wes Streeting will soon publish a 10-year plan which he hopes will save the NHS. At the heart of it is a pledge to provide care closer to home. So we've gone to look at one of the most radical schemes in action, which will see an army of workers sent door to door.
Hello Alison, how are you?
I'm all right.
And how's Malcolm?
He's right, he's at the hospital.
Yeah, I'm actually really interested in this community health worker model and the impact it's having.
As a GP, they act as my eyes and ears in the community. They know the households really well, they work alongside me and are able to provide the continuity that we're not able to give anymore.
The concept of community health workers comes from Brazil, where programmes have been rolled out since the 1990s. Today, one of the workers, Bernardo, has come from Rio to learn how the UK is following in Brazil's footsteps.
Primary care is responsible for prevent, to promote health, to maintain good community relation.
And in Pimlico, for example, they've seen a 10% reduction in hospital admissions amongst that group of families they're working with, including a 7% reduction in people going in via A&E. And I think that is the prize that's available to us if we make the NHS more of a neighbourhood health service.
The programme has begun being rolled out more widely, so I've come to Cornwall to see the largest scheme in action.
It gives residents time to build relationships with somebody and they're not limited to a 10-minute time scale like they would be with their GP.
I had a knee operation 6 months ago. The operation was fine, but I'm a widow, I'm on my own with no one. And Naomi from the Elms sort of came up and rescued me a bit. She's got care for me. She's just given me so much support, that girl. You know, give me a hug, you know, sometimes when I need it. You don't get many hugs when you're on your own.
Well, it's like no other job really. It's like no other job because you can just literally go in, identify needs, identify the problems and address them. Providing that the end result will improve their health and well-being, you can go in there with a completely blank sheet and just deliver and just change lives within a comparatively short space of time.
I think it's reducing pressure on GPs and hospitals because it is finding the root cause of anxiety and depression and putting in preventative measures with the residents so they don't need to later in life appear to their GPs and have medication for these conditions.
Advocates of the scheme say people might see it as the nanny state on steroids. But Dr. Matthew Harris, who worked on the programme as a GP in Brazil in the 1990s, says that's not the case.
Yeah, I would argue that this approach actually is the opposite to state interference because the way we're doing things at the moment in the NHS is usually providing overly prescriptive interventions to people that we think need the support. This service is completely community driven. We're recruiting residents from the community into these roles and nobody knows what the community needs better than the residents themselves.
Just getting the NHS back on its feet isn't enough. We've got to make sure it's fit for the future.